Am I stressed? When faced with a stressful event, a person evaluates the potential threat. Primary appraisal is a person's judgment about the significance of an event as stressful, positive, controllable, challenging, or irrelevant. Facing the stressful event, the secondary appraisal follows, which is an assessment of people's coping resources and options. Secondary appraisals address what one can do about the situation. Actual coping efforts aimed at regulation of the problem give rise to outcomes of the coping process. Stress evidently has an effect on our mood, behavior, and thoughts. We will encounter different challenges while taking care of our ill family members when we think we lack the required resources or capacities to face these challenges. It could lead to stress and some negative emotions. It can lead to certain undesirable behaviors, such as detachment, criticism, or overprotectiveness of the patient. The stress of a caregiver can concern numerous aspects, such as financial pressure and the stress of taking care of the family and the patient. If the patient happens to be the breadwinner before the onset of the disorder, it is very common for them to be forced to leave their position due to psychosis, which may consequently bring on financial pressure to the family. Therefore, some families may let other members go to work or take on a few more part-time jobs in order to support the family. If the patient happens to be the one who looks after the family prior to the onset of psychosis, the disorder may affect their mood and prevent them from taking care of other family members or completing the housework, which may result in disruption of the familial structure and cause other members of the family to feel stress. Due to the symptoms of psychosis, the patient may struggle with tasks that they used to be able to do. Their self-care ability may also be affected. Some of the patients may have more severe negative symptoms which cause them to lose interest in things, be unconcerned about surroundings, or even disregard personal hygiene and cleanliness, making it more stressful for caregivers. Other than that, stress can stem from concerns regarding the patient's recovery and potential uncertainty of the future. We need to relax ourselves and be composed while communicating with the patient in order to understand the needs of the patient. The concern of future uncertainty can usually be eased by focusing more on the current issues. When we are stressed, there will be both mental and physical signs, such as physical symptoms: headache, trembling, back and neck pain, tensed muscles, dizziness, cold hands and feet, sweating, dry mouth, stomachache, diarrhea or constipation, insomnia, chest pain, increased heart rate, tiredness, and increased or decreased appetite. Psychological symptoms: anxiety, worrying, guilt, irritability, becoming easily angered or frustrated, hostility, depression, feeling like they are going to collapse from the burden, tearfulness, feelings of loneliness or worthlessness, restlessness, and hopelessness. Cognitive symptoms: difficulty in concentrating, nightmares, difficulty in learning new things, forgetfulness, indecisiveness, and an unwillingness to interact with other people. If our bodies have been showing warning signs, we have to take good care of ourselves so that we can prepare ourselves, both physically and mentally, for more challenges.